The potential start date for the federal government's plan for affordable dental care is just a month away. The first Canadians eligible, seniors, will have access to the Canadian Dental Care Plan as early as May. NDP leader Jagmeet Singh encouraged seniors in Winnipeg to sign up for the program today.
Seniors are anxious. I had another senior come up to me saying, when am I going to be able to actually go into the dentist and get this sorted out, because they've got issues of pain and they've got teeth that need to be looked after. And so I want them to know that we're going to make this happen, and we're going to monitor closely to make sure that they get the coverage.
But seniors aren't the only ones with questions about the rollout plan of the new dental care plan. Heather Carr is the president of the Canadian Dental Association. Heather Carr, it's nice to meet you. Thanks for joining us today.
I'm happy to be here.
So if this plan rollout goes as intended, the first people will be eligible for access as early as May. But there's some confusion and there's some growing pains. How would you assess the status of this program right now?
Well, I would say that the Dental Association, and I'm representing the Canadian Dental Association, so I'm the national voice, is very keen. You know, we've been advocating for care for these patients for years. We have 2/3 of Canadians who have great access to care, mostly through employer-sponsored programs, but we have 1/3 of Canadians who need this plan. We're very optimistic, we're hopeful, but there's a great deal of confusion and a great deal of complications, so that it's caused the dentists and the patients to have concerns.
Okay, so let's walk through that, starting with the patients. What are some of the biggest questions you're hearing from patients about how this will work and what misconceptions they might have about this program?
Well, I think that they don't understand. They've been told that it's free, and it's not, that there will be some out-of-pocket expenses, but the dental community is unable to share what those expenses will be because we don't have all the information regarding fee grids and provincial agreements. As well, the patients are concerned because there's a large portion of dentists who have not signed up as of yet. And they are worried that they're going to find a dentist who's participating, or if their own dentist isn't participating, will they have to find a new dentist?
Right. I guess it's free in the sense that you don't have to pay premiums like people do for a benefits package, but there's a copay component is what you're talking about there. And that depends on your income. You have to pay for a percentage of whatever treatment you receive.
Yes, the fee grid the government established is not the usual and customary fees that are set by the provincial and territorial dental associations. And there also is the different levels of copay depending on your income.
Okay, and so that's what you're hearing from potential patients and customers and clients who want to sign up for this and are counting on this and their lack of certainty. What is it like for your members? I mean, what are the concerns that dentists and dental clinics have right now?
They're very concerned about the enrollment component. That's not a usual and customary practice for patients who have benefits. It's complicated, and as I mentioned before, we don't have all the information, so there's many unknowns. We're also, as I just mentioned, concerned about patient choice. Will a patient lose the dentist if you don't participate? The administration seems to be a bit complex and complicated, and we're concerned about our front desk staff. As every other healthcare sector, we're short staffed, and it has to be simple and easy to administer. And once again, the fact that we just don't have all the information. We have a plan that's ready to go by the government's standard early May, and yet the dentists don't have all the information. So I think that there's a sense that I'm getting from the provincial and territorial dental associations that a lot of their members are hesitant to sign up because, for one, we've never had to sign up to provide care. The relationship should be between the dentist and the patient, not between the dentist and the government.
Right, because the way it works from when I go see my dentist, I mean, the CBC has a benefits package, I have dental coverage, I give them my insurance information, I pay, they send it off, and I get reimbursed. So that sort of a process wouldn't work here. Individual members would have to sign up, and I know we talk about administrative burden being an issue for family doctors and stuff, but I guess this creates a situation where administrative burden will become an issue in dental clinics.
Absolutely. And dentists and dental offices have dealt with the insurance industry for years, but not at this level and not with the principles that the government has applied to this plan. They've made the terms and conditions quite onerous, and we just need it to be simple. It could be so simple. We just need to be simple and smooth, and that way the patients get the care that they need.
It seems a simple way to do it is almost like a benefits card, right? Like that you would have through normal insurance of the government issuing some sort of a number tied to the patient that then you can just bill it to at the clinic end. But explain to me what the sign-up requirement is for an individual dentist office and what sort of the hurdles and the challenges are there, because this seems like if it's not worth your effort, it's going to be a failure to launch.
Yeah, well, for one, we've never had to sign up to provide care for patients before. You know, we have that relationship with the patient. And it's not the sign up that necessarily is complicated, but it's what are the terms and conditions attached to that sign up. And those are the things that need to be clarified and need to be fair to the dentists so that they can take care of the patients.
But what are your big concerns there? Like what kind of conditions are on the table right now that are problematic?
Well, one example would be pre-authorizations. For the first 6 months, this plan has very limited coverage, and the pre-authorization is not going to be available for 6 months. So say you're a senior who needs a cleaning, and very limited amount of cleaning would be available until we can get pre-authorizations. And at this point, that means you'd be waiting for 6 months until the pre-authorizations are available. So that just of itself, we're also, you know, it just, every little detail tends to make it a little more complicated for us to get the care that the patients require.
Okay, so obviously if dentists find it too cumbersome and either don't sign up or don't sign up at scale, that's going to be problematic for this program to hit the target, right? And the government says more than 1.6 million Canadians have registered for the program. Have you got a sense of how many dentists have registered for the program and how many would need to register to handle that need?
Well, the government has the numbers of how many have registered. We're getting a sense, we've got 25,500 dentists across Canada taking care of these patients. And at this point, just based on some, you know, conversations and amongst the provincial and territorial dental associations, we anticipate it's a very low number compared to what the opportunity is.
Can you ballpark that for me? Like less than half, less than a quarter, 10%? What kind of ratio, percentage are we talking here?
I just based on the information that I've received, I would guess maybe 10 to 15%, but please, I do not have the exact number. So I would just be, this would be based on talking to the different associations across the country.
No, but
and that's to date.
Right.
That's to date.
Right. No, and it could change. It could grow from there, or that could be it, right? But that kind of a ratio, I would presume, I've never run a dental clinic, I've never gone to dental school, you would need quite a much larger take-up than that if this is going to have the impact people are counting on.
Well, I would hope so. You know, we're very keen to get the patient's care. So we just need to get some of these details and get a plan that's simple to administer so that we can take care of the patients. A little more, more like a regular benefits plan. I think the dentist, you know, we take care of our patients. We do a lot of work for our patients. We try to be fair. There's a lot of, I guess we call it pro bono in law or in dentistry. But at this point, we really want the opportunity to provide this 1/3 of Canadians the access they require.
So this is supposed to get started in a month. Just as a final point, Heather Carr, what do you need to see between now and then with the government of Canada in terms of smoothing out some of these concerns? They say they consulted with you, but it sounds like it hasn't quite landed where you need it to be.
You know, we've had good conversations, but we need them to really pay attention to these concerns. We set up some criteria, some recommendations back in February 2023, and a lot of the concerns are the ones that we're discussing this evening. So if the government would sit down again with us and listen to some of the suggestions and try to simplify this plan, I think that they would see that the dentists are very keen to treat. You know, we applaud the opportunity that has been provided by CDCP to care for patients who don't have care. And we know this is a complex initiative, but if we don't get it right from the very beginning, then I don't think it's going to fare well for either the patients or the dental community.
Heather Carr, President of the Canadian Dental Association, thanks so much for your time.